Picture this. You're a farmer in ancient Egypt around 2500 BCE, the year of the pharaoh Khufu, builder of the Great Pyramid. You're working in the scorching Nile Valley when your bronze sickle slips, gashing deep into your forearm. Blood pours from the wound. In our world, you'd rush to an emergency room for stitches and antibiotics. But here, there are no hospitals, no sterile operating rooms, no understanding that invisible creatures called bacteria are about to invade your bloodstream. Your family carries you to the local physician priest. He's not wearing scrubs. He's in linen robes, his head shaved, ceremonial amulets around his neck. But watch what he does next. First, he cleans the wound with water from a specific canal. They've learned some water sources cause less infection than others. They don't know why. They just know it works. Then comes something that would make modern doctors recoil. He takes moldy bread from a clay pot and presses it directly into your wound. Next, he smears honey over everything and wraps it with linen strips soaked in tree resin. You survive. The infection never comes. Here's what's remarkable. That moldy bread contained primitive penicillin. The honey? It's antibacterial and creates a protective barrier. The tree resin? A natural antiseptic. This physician had zero knowledge of microbiology, chemistry, or pharmacology. Yet, through observation, documentation, and centuries of trial and error, ancient healers developed treatments that actually worked. This is the story of medicine before science, where humanity's survival depended on the courage of healers who experimented on themselves, the wisdom of cultures that documented every success and failure, and the patients who had no choice but to trust them. Welcome to Medicine Through Time.
Act 1. The Four Great Traditions. To understand how medicine emerged from the shadows of prehistory, we need to travel to four corners of the ancient world, where four completely separate civilizations independently developed medical systems so sophisticated we still use elements of them today.
The Edwin Smith Papyrus, written around 1600 BCE but copying knowledge from 1,000 years earlier, is the world's oldest surgical document. And it's stunning. It describes 48 different surgical cases, head injuries, spinal trauma, broken bones, each following the same format: title, examination instructions, diagnosis, treatment, and prognosis. Sound familiar? That's because it's essentially the same format doctors use in patient charts today. Here's what blows my mind.
The Ebers Papyrus, another medical text from 1550 BCE, documents over 700 remedies. We're talking specific prescriptions. For a cough, take dates, cat's fat, and sweet beer. Heat and drink for 4 days. Now, I can't vouch for the cat fat, but here's what's extraordinary. They recognize that the heart pumps blood through vessels throughout the body. Europe wouldn't rediscover this until William Harvey's work in 1628. That's 3,000 years later. Egyptian physicians could set broken bones, stitch wounds, and perform dental work. They created prosthetics, artificial toes made of wood and leather that actually functioned. Archaeologists have found mummies wearing them, with wear patterns proving they were used in life, not just for burial.
But they also believed disease could be caused by angry gods or vengeful spirits. Their treatments mixed effective medicine with magical incantations. They couldn't separate what worked from why they thought it worked. That limitation would define ancient medicine everywhere.
India, the surgeons of Ayurveda. Now travel east to the Indian subcontinent, where around 1500 BCE, a completely different medical tradition was emerging. Ayurveda, meaning knowledge of life. Ayurvedic medicine viewed the body as a balance of 3 doshas: Vata, Pitta, and Kapha, essentially biological energies controlling different bodily functions. Imbalance caused disease. Balance restored health. It sounds mystical, but it led to remarkably sophisticated medicine. The Sushruta Samhita, compiled around the 6th century BCE, but containing much older knowledge, is one of the foundational texts of surgery. Sushruta, its attributed author, is sometimes called the father of plastic surgery, and he earned that title. Why? Because in ancient India, nose amputation was a common judicial punishment. Criminals and adulterers would have their noses cut off as public humiliation. So surgeons developed rhinoplasty, nose reconstruction, using a forehead flap technique. They would cut a flap of skin from the forehead, twist it down, and fashion it into a new nose, keeping the blood supply intact until it healed. Stop and think about that. No anesthesia beyond alcohol and opium derivatives. No antibiotics. No understanding of blood types or immunology. Yet they were performing reconstructive surgery so sophisticated that the British surgeons who discovered this technique in 1794 were simply learning it from Indian physicians who had been doing it for 2,000 years. The Sushruta Samhita describes over 300 surgical procedures and 120 surgical instruments. It covers everything from cataract removal to cesarean sections to bladder stone removal. It emphasizes the importance of practice. Students were instructed to practice incisions on watermelons, puncturing on lotus stems, and suturing on leather before touching patients. Ayurvedic physicians also pioneered concepts we'd recognize today. They understood diabetes. They called that mahumeha, or honey urine, because they noticed ants were attracted to diabetic patients' urine. They recognized that some diseases were contagious and advocated isolation. They practiced dissection to understand anatomy, though religious restrictions limited how much they could do. The sophistication is staggering, especially considering the timeline. While Europe was still emerging from the Bronze Age, Indian physicians were conducting complex surgeries and documenting outcomes.
China, the path of balance. In China, medicine evolved along a completely different philosophical framework, yet arrived at equally impressive results. Traditional Chinese medicine, TCM, emerged from the belief that health depends on the balance of qi, life energy, and yin and yang, complementary forces. Disease occurred when these forces fell out of harmony. The goal wasn't to kill disease, but to restore balance. The Huangdi Neijing, or Yellow Emperor's Classic of Internal Medicine, compiled around 300 BCE from much older oral traditions, established the theoretical foundation. It introduced concepts like the meridian system, pathways through which qi flows, and the 5 elements theory that classified organs, tissues, and symptoms into interconnected categories.
This led to diagnostic techniques like pulse examination. Chinese physicians identified dozens of distinct pulse qualities at 3 positions on each wrist, each indicating different imbalances. Modern medicine dismissed this as superstition for centuries, but recent studies using sensitive equipment have found that different diseases do create measurably different pulse patterns. Ancient Chinese doctors were detecting signals Western medicine didn't have instruments to measure until the 21st century.
Acupuncture, inserting thin needles at specific points to influence qi flow, became TCM's signature treatment. The Huangdi Neijing describes 160 acupuncture points. Modern charts show 361 standard points. For 2,000 years, Western medicine called this placebo effect. Then, controlled studies started showing real physiological effects: pain reduction, inflammation control, nausea relief. We still don't fully understand the mechanism, but functional MRI scans show acupuncture does trigger measurable brain activity changes.
Chinese herbalism was equally sophisticated. The Shennong Bencao Jing, compiled around 200 CE, describes 365 medicinal substances, one for each day of the year, as the text poetically states. These weren't random folk remedies. They were systematically categorized by properties: warming or cooling, moistening or drying, which organs they affected.
And here's a crucial example of ancient medicine's lasting impact: artemisinin. For 2,000 years, Chinese physicians used sweet wormwood, Artemisia annua, to treat fever. In 1969, Chinese scientist Tu Youyou was tasked with finding new malaria treatments. She went back to ancient texts, extracted artemisinin from sweet wormwood, and created the world's most effective anti-malarial drug. It saved millions of lives in Africa and Asia. She won the Nobel Prize in 2015 for rediscovering ancient medicine.
Greece, the birth of rational medicine. Finally, we arrive in ancient Greece, where medicine took perhaps its most revolutionary turn: the separation of healing from religion. Around 460 BCE, on the island of Kos, a physician named Hippocrates began teaching something radical. Diseases have natural causes, not supernatural ones. Epilepsy wasn't divine possession. It was a brain disorder. Diseases weren't punishments from angry gods. They resulted from imbalances in the body's four humors: blood, phlegm, yellow bile, and black bile. Now, humorism was wrong. Completely wrong. But here's what mattered. Hippocrates insisted on observation, documentation, and natural explanations. He taught physicians to examine patients systematically, record symptoms, note which treatments worked, and learn from failures. He created medicine as a discipline, not just a practice. The Hippocratic Corpus, texts attributed to Hippocrates and his students, established principles that doctors still follow. The Hippocratic Oath, in modified form, physicians still swear. "First, do no harm," comes from this tradition, though interestingly, that exact phrase doesn't appear in the original oath. Hippocratic medicine emphasized prognosis, predicting disease progression, as much as treatment. Physicians would observe a patient, recognize patterns from previous cases, and tell families what to expect. This built trust and established medicine as a respected profession. Greek physicians advanced anatomy through observation. They couldn't do human dissection. Religious taboos prevented it, but they dissected animals and extrapolated. This led to errors, but it also led to genuine discoveries about organs, blood vessels, and nerves. Then came Galen, working in Rome around 200 CE, who synthesized Greek medical knowledge into an enormous body of work, over 20,000 pages. Galen performed public dissections, conducted experiments, and wrote prolifically. His texts would dominate European medicine for 1,400 years. 4 traditions, 4 different philosophical frameworks, 4 completely separate development paths, yet all arrived at the same destination: systematic, documented, teachable medicine. That convergent evolution suggests something profound. Observation and evidence, even without modern scientific method, can lead to truth.
Act 2. How it actually worked. So we've seen what ancient medicine looked like. Now let's answer the harder question. How did it actually work? How did healers with no understanding of microbiology, biochemistry, or physiology develop treatments that genuinely helped patients? The answer reveals something important about human intelligence and the scientific process, even before we called it science.
The power of observation. Ancient physicians were extraordinarily observant. They had to be. Observation was their only tool. Consider pain relief. Cultures worldwide independently discovered plants that reduced pain. Willow bark in Europe and Asia, coca leaves in South America, opium poppies in the Mediterranean. They didn't know about salicylic acid, cocaine, or morphine,
but they observed that certain plants, prepared in certain ways, reliably reduced suffering.
Willow bark is the perfect example. Ancient Egyptians mentioned it in the Ebers Papyrus. Hippocrates prescribed it. Native Americans used it. Chinese physicians included it in their pharmacopoeia. Everyone noticed the same thing. Tea made from willow bark reduced fever and pain. In 1763, English clergyman Edward Stone conducted the first clinical trial of willow bark, though he didn't call it that. He gave it to 50 patients with fever and documented their improvements. In 1897, chemists at Bayer synthesized acetylsalicylic acid from the active compound in willow bark and called it aspirin. Today, we consume about 40,000 tons of aspirin annually. A 3,000-year journey from observation to molecule.
But here's what's remarkable. Ancient physicians didn't just notice willow bark worked. They figured out preparation methods. Too much caused stomach upset. They learned to adjust doses, time administration, and combine it with other substances to improve tolerance. That's empirical research. They observed surgical outcomes too. Egyptian physicians noted that wounds cleaned with certain water sources healed better. They didn't know about bacteria, but they noticed a pattern. Indian surgeons learned that operating in clean, cool environments improved survival. Greek physicians noticed that gladiators who received immediate wound care were more likely to survive than those treated later. Observation led to protocols,
documentation, and transmission. But observation alone isn't enough. Ancient medicine worked because civilizations wrote it down. Medical texts served as collective memory, allowing each generation to build on the previous one's discoveries without starting from scratch. The Edwin Smith Papyrus wasn't one physician's notes. It compiled centuries of Egyptian medical knowledge. The Ayurvedic Samhitas weren't individual insights, but distilled wisdom from generations of practitioners. This documentation included failures. The Edwin Smith Papyrus lists cases not to be treated, conditions beyond their ability to cure. That's crucial information. It tells future physicians not to waste resources on hopeless cases and protects physicians from blame when patients inevitably die. Medical texts also standardized training. In ancient India, students studied for 7 years under a master physician, learning from texts before touching patients. In China, medical knowledge was often kept within families, passed father to son through texts and oral instruction. In Greece, medical schools formed around famous teachers, with students paying for instruction and copying texts. This created something unprecedented, a body of knowledge that improved over time. Each generation could test previous claims, discard what didn't work, and add new discoveries. It was slow, painfully slow compared to modern research, but it was cumulative progress. Trial, error, and courage. Here's the uncomfortable truth about ancient medicine. Many discoveries came from desperate experimentation, often on patients who had no other options. Take trepanation, drilling holes in skulls to relieve pressure from head injuries. Archaeologists have found trepanned skulls from virtually every ancient culture. Some show bone regrowth, proving patients survived. But how did surgeons learn to do this? Someone had to be first. Someone had to take a stone or bronze drill to a living person's skull, not knowing if it would help or cause immediate death. The survival rate probably started very low, but each attempt taught something. How deep to drill, what symptoms improved, which locations were safer. Gradually, skilled surgeons figured it out. By Roman times, physicians like Galen could perform trepanation with decent success rates. Or consider the Chinese discovery of smallpox inoculation, variolation. The technique involved taking scabs from a smallpox survivor,
grinding them into powder and blowing the powder into a healthy person's nose. The person would develop a mild case of smallpox and gain immunity.
But smallpox killed 30% of infected people. Can you imagine being the first person to deliberately inhale smallpox? Or being the physician who convinced someone to try it? This was incredibly dangerous. Variolation itself had a 1 to 2% mortality rate. But it was better odds than natural infection, so parents chose it for their children. Eventually, the practice spread across Asia, then to the Ottoman Empire, then to Europe. The courage required, both from physicians and patients, is staggering. Every advance in ancient surgery came at tremendous cost. No anesthesia meant patients had to be held down or strapped to tables. No antiseptics meant infection killed many who survived the operation. Speed was the surgeon's greatest skill. The faster the procedure, the lower the chance of the patient dying from shock or blood loss. Yet they kept trying. They kept learning, because the alternative was watching people die without even attempting to help.
What they got right. Despite the limitations, ancient medicine got remarkable things right. Honey for wound care, modern research confirms it's antibacterial, promotes healing, and works against antibiotic-resistant infections. Medical-grade honey is now used in hospitals worldwide. Moldy bread on wounds. Certain bread molds produce penicillin-like compounds. Egyptian healers were applying topical antibiotics 3,000 years before Fleming's famous Petri dish. Maggot therapy for infected wounds. Maggots eat dead tissue while leaving healthy tissue alone, and they secrete antibacterial compounds. The practice declined with antibiotics, but has returned as antibiotic resistance grows.
Bloodletting? Okay, that one was mostly wrong. It persisted for 2,000 years based on humoral theory and probably killed more people than it helped. But even here, there's nuance. Bloodletting can help in specific conditions like polycythemia or hemochromatosis. They had the wrong theory but stumbled onto a occasionally useful treatment. Ancient physicians understood wound care basics: clean wounds, stop bleeding, protect from contamination, and keep the patient's strength up with good food. These principles remain unchanged. They understood pain management, using alcohol, opium, cannabis, and other substances. They weren't as effective as modern anesthetics, but they helped. They understood the importance of cleanliness, even without germ theory. They observed that clean operating environments, clean water, and clean bandages improved outcomes. They understood quarantine. When diseases seemed to spread from person to person, they isolated the sick. The word quarantine comes from the Italian 40 giorni, 40 days, the isolation period Venice imposed on ships during plague outbreaks in the 14th century. But the practice is far older. The Book of Leviticus describes isolation procedures for leprosy. Ancient societies worldwide practiced some form of quarantine. What's astounding is that observation alone, without understanding mechanism, led them to many correct practices. They couldn't see bacteria, but they figured out bacteria didn't like honey, clean water, or isolation. They couldn't measure biochemistry, but they found plants that altered it beneficially.
Act 3. The Limits and Legacies. Where ancient medicine failed. But let's be clear about ancient medicine's profound limitations. For all its successes, the vast majority of patients who would survive today died in the ancient world. Childbirth was a death sentence for countless women. Maternal mortality probably ranged from 1 to 3%, meaning roughly 1 in 50 births killed the mother. Infant mortality was worse. Perhaps 30% of children died before age 5. Ancient physicians could do almost nothing about it. Infections killed constantly. A simple cut could become fatal sepsis. Pneumonia, tuberculosis, and other respiratory infections ravaged populations. Ancient physicians had symptom relief but no cures.
They couldn't treat most internal diseases. Appendicitis, stomach ulcers, kidney stones, all potentially fatal, all beyond their surgical reach. They could diagnose many conditions, but not cure them. They got anatomy wrong in important ways. Greek physicians thought blood was produced in the liver and consumed by the body, not circulated. They thought the brain cooled the blood and the heart was the center of thought. Chinese medicine located emotions in organs, anger in the liver, worry in the spleen. These weren't just philosophical errors. They led to ineffective treatments based on faulty models. They believed dangerous nonsense. Mercury was used to treat syphilis, despite being highly toxic. Lead was used in cosmetics and wine preservation, causing chronic poisoning. Various cultures practiced procedures that helped nothing and harmed much.
And superstition infected everything. Even the most rational Greek physician might recommend amulets alongside herbs. Ayurvedic treatments included rituals. Chinese medicine incorporated astrology. They couldn't separate effective treatments from cultural beliefs. Life expectancy at birth in the ancient world was around 25-30 years. But here's important context. That's heavily skewed by infant mortality. If you survive childhood, you might reach 50 or 60. Still, that's far shorter than modern lifespans. Ancient medicine kept some people alive who would otherwise have died, but it couldn't save most of them.
The knowledge bottleneck. Progress was also agonizingly slow because knowledge transmission was fragile. Medical texts had to be hand-copied, errors crept in, libraries burned. The Library of Alexandria, which held irreplaceable medical texts, was destroyed in stages over several centuries. Wars scattered scholars. Plagues killed physicians along with their patients. Moreover, different medical traditions rarely communicated. Egyptian medicine didn't influence Chinese medicine. Greek physicians knew little of Ayurvedic practices. Each tradition developed in isolation, unable to learn from others' discoveries or avoid their mistakes.
When traditions did meet, as when Islamic scholars encountered Greek medical texts during the Islamic Golden Age, progress accelerated. Physicians like Avicenna and Rhazes synthesized Greek medicine with Persian and Indian traditions, advancing surgery, pharmacology, and anatomy. But such moments were rare. Religious and cultural barriers also limited progress. Dissection was forbidden in many societies, preventing anatomical understanding. Women were often excluded from medical practice, eliminating half of potential practitioners. Class barriers meant folk remedies used by common people never reached the medical texts written by educated elites. And then there's the core limitation. Without the scientific method, without controlled experiments, without statistics, ancient physicians couldn't reliably distinguish what worked from what didn't. They observed patterns, but couldn't prove causation. This meant effective treatments were mixed with ineffective ones, with no clear way to separate them.
The transition to modern medicine. The transformation from ancient to modern medicine didn't happen overnight. It took centuries and required multiple revolutionary insights. The Renaissance brought renewed interest in human anatomy. Andreas Vesalius's 1543 book, De Humani Corporis Fabrica, corrected Galen's errors through careful dissection. But this was 1,300 years after Galen, 13 centuries of anatomical misconception. The scientific revolution introduced experimental method. William Harvey proved blood circulates in 1628 through elegant experiments, but ancient Egyptian physicians had observed this in 1550 BCE, 3,000 years earlier, and been forgotten. The microscope, invented in the 1590s, revealed a hidden world. Antony van Leeuwenhoek first observed bacteria in the 1670s, but nobody connected them to disease for another 200 years. Germ theory, proposed by Louis Pasteur and Robert Koch in the 1860s, finally explained infection. Suddenly, all those ancient practices, clean water, wound care, quarantine, made sense. Ancient physicians had been right, without knowing why. Anesthesia arrived in the 1840s with ether and chloroform. For the first time in history, surgery wasn't torture. Antiseptics followed in the 1860s with Joseph Lister's carbolic acid. Infection rates plummeted. Antibiotics, penicillin discovered in 1928, mass-produced in the 1940s, were perhaps the greatest revolution. For the first time, physicians could cure bacterial infections rather than just managing symptoms. Each advance vindicated some ancient practice while rendering others obsolete. Ancient physicians were right about wound care, but wrong about humors. Right about herbal medicines, but wrong about bloodletting. Right about quarantine, but wrong about disease causes. Modern medicine didn't reject ancient medicine, it refined it. We kept what worked and discarded what didn't. But crucially, we could now explain why things worked, allowing targeted improvements.
The Pacific yew tree, used by Native Americans for various ailments, yielded paclitaxel, now called Taxol, a revolutionary cancer treatment. Traditional use pointed researchers toward active compounds that might have taken decades to discover randomly. Even practices once dismissed as pure superstition are getting second looks. Acupuncture, scorned by Western medicine for centuries, now has enough evidence of efficacy that major hospitals offer it. The mechanism isn't fully understood. It's probably not about qi flowing through meridians, but fMRI studies show it produces measurable physiological effects. Meditation and mindfulness, core to Ayurveda. The World Health Organization now recognizes traditional medicine's value. A 2019 WHO report noted that 88% of countries report using traditional medicine, and it's often the primary healthcare source in developing nations. We're also learning from ancient holistic approaches. Modern medicine's specialization, while allowing deep expertise, sometimes loses sight of the whole patient. Ancient traditions emphasize treating the person, not just the disease. That's being reintegrated as integrative medicine, combining conventional treatment with complementary approaches. There's also profound interest in ancient medical ethics. The Hippocratic emphasis on patient welfare, confidentiality, and teaching responsibilities resonates across cultures and centuries. Ayurvedic medicine's focus on prevention rather than just treatment aligns with modern public health's emphasis on lifestyle and diet. We're even reconsidering ancient surgical techniques. Some traditional suture methods prove more effective in specific situations than modern alternatives. Traditional bone-setting techniques inform orthopedic practice. The lesson isn't that ancient medicine was equal to modern medicine. It wasn't. Infant mortality, life expectancy, and treatment success rates prove that decisively. But ancient medicine wasn't ignorant guesswork either. It was humanity's first systematic attempt to understand and treat disease. And those early physicians got more right than we sometimes credit.
Conclusion. So what's the legacy of ancient medicine? First, it established medicine as a learnable profession, requiring training, ethics, and dedication. That professionalization separated real healers from charlatans and quacks, though plenty of both existed. Second, it proved that observation and documentation, even without modern scientific tools, can lead to genuine knowledge. Ancient physicians couldn't explain mechanisms, but they identified patterns. That's the foundation of science. Third, it created traditions of knowledge that survived millennia. Some of that knowledge was wrong, but enough was right to keep populations alive through plagues, famines, and wars. Without ancient medicine, human populations couldn't have grown enough to build civilizations. Fourth, it reminds us that intelligence and ingenuity aren't modern inventions. ancient physicians working with stone and bronze tools solved problems we struggle with today using supercomputers. Their resourcefulness is humbling. And finally, ancient medicine teaches us that caring for the sick is fundamentally human. Every culture, every civilization, every era has had healers who dedicated their lives to reducing suffering. That compassion connects the Egyptian physician-priest with the modern ER doctor across 5,000 years.
The techniques have transformed beyond recognition, but the commitment to observe carefully, document honestly, learn from mistakes, and never stop trying to help, that's the through line from ancient medicine to modern medicine. Next time you take an aspirin, remember the ancient healers who first chewed willow bark and documented that it helped. Next time you see honey in a wound care kit, remember the Egyptian physicians who packed it into gashes. Next time acupuncture relieves someone's pain, remember the Chinese physicians who mapped those meridians. They didn't have labs, but they had curiosity. They didn't have clinical trials, but they had courage. They didn't have technology, but they had thousands of years of accumulated wisdom, and they used it to save lives. That's medicine before science, and it's where everything began.
Next episode, surgery before anesthesia. We're going deep into the horror and heroism of operations when speed was the only mercy and survival was a miracle. You won't believe what patients endured and what surgeons accomplished anyway. Until then, stay curious.